Today we're going to talk about something slightly different, and that's inequalities in MS care around the globe. We've got together people from different countries. What we've asked them to do is to give us their top areas of inequality in MS care. When we spoke to Anjali Vyas in India, she said the following.
The awareness on MS is quite low. Imagine my case, yeah. When I was, facing the issue of vision, my Afghan did not know anything. Had he not referred me to another specialist, probably I would have lost my vision completely.
Tell me about access to drugs.
They are supplied if you've got the right neurologist or the right medical representative. People can find the drugs, but it's not that easy because only after a neurologist recommends you some medication, you can then maybe seek a medical representative of a particular pharma company or maybe a drug dealer or so, and then you can have those drugs.
And you have to pay for them?
Yes, we have to pay for them.
So in summary, there's the awareness of MS as a thing, as an actual disease that really needs to be counted. It's quite far down people's lists in a lot of the equatorial countries because the incidence is growing. Getting access to all the drugs that you would like is quite difficult. So even if your neurologist would like to prescribe them to you, they're not there. And the other thing is, it's income related. You have to pay for your drugs. I know Anjali pays for hers. So if you are in a position where you can't afford to pay for them, it's really even harder. It's really difficult. But even when you can afford to pay for them, it's quite a palaver to get them. I know Anjali travels, I think it's 50 to 60 miles once a month to go collect her drugs from, they call it a dealer, but it's a good thing there. It's one of the suppliers. You have to just go to the person who handles it. So that's tricky as well. I spoke to a neurologist in the United States. His name's Dr. Barry Singer, and he's a specialist MS neurologist. And he surprised me because we think about the United States sometimes as a land of plenty, and there's enough of everything, especially with the healthcare system there. But Barry made some interesting points, as we'll see now.
I think really the biggest challenge that I see in terms of inequality is access to care, access to MS specialists. A lot of people are living in small towns in the country, and they really don't have access. They have access to some general neurologists locally. And, and a lot of those times, those people do not have the training in MS. And because there's 20 plus drugs available in the United States now, it becomes very challenging for people to get access to the correct treatment early. So I see a lot of undertreatment. And I think it's cultural too. Like, you don't challenge the doctor. I think it's just it's a certain kind of polite, considerate mindset, but I think people end up losing ground, and sometimes they come to me and things are fairly advanced. The same thing can happen in inner city areas. We know in the United States that Black Americans end up with, or more likely to end up with, significant disabilities. So we see some Black patients that are not getting the treatment they need or being undertreated. And so I think those are huge issues of accessing. Now, access to medication in the United States is actually available. So if you're underinsured or uninsured, you could get actually free medication through the pharmaceutical companies. The problem is a lot of people don't know that. And so that's a big issue. I saw someone recently, for 10 years, they had MS, never knew they had MS, but were uninsured or underinsured and didn't feel like they could access the medications and didn't realize they could get free medication. That information is not out there.
So to summarize Barry's points, access to care, if you live in rural areas, you'll find that the experts tend to congregate around the city. So it's a big place again, and it's harder to get there, and it's harder to be diagnosed sooner, and it's harder to have consistency of care unless you can get yourself in front of an MS specialist neurologist. In the United States, we all know if you're going to get sick, you really want to have healthcare. And as Barry says, access to medications that are really expensive can be provided by the drug companies. They often do this, and many people don't know. So it's really worth exploring what sort of support schemes drug companies have if you're struggling to afford the medications and insurance. And on top of that, as Barry said, I know he's heavily involved with the MSSA, which is the Multiple Sclerosis Society of America. If you can't afford MRIs, they will pay for it for you. So you need to apply to them, but in order to have your care monitored with regular MRIs, that can be done. Let's jump to Egypt now and speak to Dr. Mohammed Abdul Wafali, who just said to me, call me Wafa, which I was very grateful for. Wafa is actually a specialist MS neurologist, and he's doing research in the UK, and I caught up with him in the UK.
The main problem, I think, is the access to the neurological service. So unless you do have an access to one of the MS centers or neurological services in the main cities, a lot of things can be messed up for a significant period of time, especially for a condition like MS. Patients tend to start only very subtle, and unless the symptoms are quite disabling, you may not decide to travel and get a plan to get a proper help with it. So most neurologists, or even all the neurologists you can imagine, that will be in the main cities, and you need to travel to one of them. So you end up with a lot of patients who maybe disproportionately don't have an access to a neurological service. But once there, all what you can imagine regarding assessments, lab-wise or imaging-wise, it's immediately available. Starting from your clinical evaluation, lab assessments, MRI scans, lumbar punctures, you can get everything sorted within a matter of few days. Like, we do have an underestimation to the real prevalence of MS in Egypt, because a large population are just underrepresented. So and they don't have the access for us to be aware that there is higher prevalence in MS.
So to summarize Wafa's points, access to neurological services, really tricky in some parts of Egypt. The prevalence of MS is higher than it is perceived, and that echoes the experience in India. The access to effective medications early is very difficult. What we're really interested to know is, what are your experiences? Where do you live? What do you think the inequalities are where you are? And how have some of them been addressed? How do you get around them? How have you seen other people get around them? MS patients around the world are relying on the expertise of other MS patients.